Hi, I'm Virginia, and I am from the Patient Information Forum, also known as PIF. And I'm here today with Dr. Asmine, who is a health information content creator. Today, we're going to ask them how they create trusted, evidence based health information. And you'll also learn about what they do and why they do it. And maybe you can do it too. So let's get started. Thank you, Dr. Asmine, for being here today.
Hey, it's such a pleasure. Thank you so much for having me, Virginia. And yeah, I'm excited to talk about the health content I make and how I go about making it.
Thank you so much. Okay, so let's start with the first question. What kind of health information do you create?
So, I make a variety of health content, but my ethos is that it should generally be patient focused, but some of the stuff that I make is also focused on helping medical students and healthcare professionals improve their knowledge, help in their exams, but also enable them to use patient-centered language and kind of eliminate jargon and kind of connect together those two worlds essentially. So when it comes to that, um, my process is I would generally write a script of some sort, and then I would film and edit videos, and then I would post them to social media so they get a broad reach across a diverse range of um, people of different ages, genders, ethnicities, and backgrounds all around the world. And I feel that social media is um, really a way to democratize that information. And we know that video content is really engaging. That's where it's at. Most people aren't going to spend ages reading long reams of text. And I think that video is just the perfect way to get health information out there in a way that people can relate with.
Amazing. So you create videos mainly, and you've mentioned some reasons why you create health information. So could you share a few kind of standout moments from the types of health information that you've created so far?
Yeah, absolutely. When I first started um, on my YouTube channel, for example, I always wanted to make a YouTube channel. And then at first, I started experimenting with different content types. And I realized that my unique selling point is that I am a medically qualified health professional and I have a passion for making videos. So why not put those two together in order to make health content that reaches out to so many people? And I started properly doing that about 2.5 years ago, and I've never looked back because the pinch me moments have been being invited by YouTube to speak on stage about how I make high quality health information, including short videos that tend to get a lot of traction. My Instagram account going from about 1,000 to 100,000 followers in a week from my medical quizzes aimed at both the spectrum from lay people and young people all the way to medical professionals in a gamified way, so it really engages them. Being invited to 10 Downing Street to meet the Prime Minister for a health briefing, being invited on the news to talk about the heat wave, which is one of the topics that first went viral on my TikTok account. And that was following NHS advice on how to stay safe in the heat wave. And another one of my videos that went viral is when there was the polio virus outbreak across Europe. And then I got approached by Rotary International to do a content collaboration with them. And since then, I've collaborated with organizations like UNICEF as well for World Immunization Week. And there are other things in the works that I'm just really, really excited about. So, in summary, it is astounding what can happen when you start to create content that you're passionate about. And I know that I have a serious role to play with my authority as a healthcare professional, but it is also really fun being a creator on social media, creating content and seeing the positive response of those that see my content, and being able to have these incredible opportunities with charities and health organizations to reach out to as many people as possible.
It's really amazing to hear that you have such a wide reach and you are working with charities and also seldom heard groups, and also trying to reach in an accessible way people from all over the world with the information that you're creating, and from the standpoint of a healthcare professional, because I imagine it can be a challenge to do your day job and create all of this content as
Yeah.
well. So I'm sure your followers and the people that you work with very much appreciate the time and effort that you put into your content, and it shows because you're starting to build that platform for people to stand on, as it were. So as a final question, and thank you for everything that you shared so far. As a final question, as you know, at the Patient Information Forum, our mission is to help people like you to provide that accessible health information for patients and the public. And so last year we created a set of standards for health information called the Individual. I'll say that again because I got an email. So last year, we created a set of standards for health information called the Individual PIF TICK, and you took part in the pilot for that to try and be one of the first to earn a trusted information creator logo to put on your content. And so I wanted to take a moment to say thank you for taking part, because your feedback helped shape the Individual PIF TICK for future health information creators. So the next question is, when it comes to how you create your health information, how did the Individual PIF TICK assessment help you with your content creation process? And what were the key learning points that you took away from the assessment, where you had to look at your content creation process that we reviewed and approved to give you an accreditation?
Yeah, I think being involved in the Individual PIF TICK accreditation scheme, the pilot, has just been so useful for a number of reasons. Um, I'd say that being a health content creator, or just a content creator in general, can be very lonely. It can be a lonely process trying to figure it out. But then, being a health content creator, you have to consider the level of authority that you have and how careful you have to be about the content you produce. So I am adamant that I want to be a high quality, evidence based creator. And I think that the PIF Tick pilot has really helped consolidate the way that I make content. So it's been really useful to get feedback about the things I'm doing right, and the encouragement that I've got from you guys, but also the things where I can be improving, or where I'm not quite at that stage yet. But for example, reviewing my content, making sure it's up to date, making sure it's all accurate and held to high quality and evidence-based standards. Also, things like things that were in the back of my mind, but I hadn't actively considered, like how do I make sure that my content is accessible to a wide variety of people who may not have English as a second language, especially important for me as someone with an international audience. So I had tips on how to make my videos in as plain language as possible, how to reduce or very carefully explain any medical jargon that I'm using. Also, to really outline my creation process in a document, to make sure that I'm ticking off the boxes every time, to make sure I'm organized in my content creation process and I don't miss out any important steps. And it's also an opportunity to have an accreditation mark against my content, to be able to show people that, yes, there is someone reviewing my content. I'm not just putting out random stuff onto the internet. I am not just using my own brains, but other people's brains, as well as high quality information that I've found to put this together. Because there's just so much misinformation out there. And I think this scheme really encompasses the fact that we're coming together as a community of health creators and championing high standards for the content that we make. So I think it's that process of being in it together and holding each other accountable that has been most helpful in being part of this PIF TICK pilot. And that's why I'm excited to see where it goes, to continue being part of this community, to see how other creators react to having a PIF TICK and making better and better content for their audience.
Amazing. Thank you so much for sharing all of that. And it was really insightful, and it was so helpful to share that with the audience as to your process and why you do what you do, and some of your highlights so far from everything that you've created. So on that note, I have something for you. So
Okay.
so I'm going to share my screen to show this to you, and hopefully this works. Let's share screen.
Exciting.
So this is your certificate. So you
Wow.
are an accredited PIF TICK quality mark for health content creation.
Yay.
So, so from the 1st of February, you will be able to put the PIF TICK logo, which is a trusted information creator logo here with a big green PIF TICK on it, to say that we have seen your health content creation process and approved it, and it's signed off by Dan Wills, our quality mark manager. And this certificate is valid for 1 year. So as part of the process, you will be able to use the PIF TICK logo on anything that you produce that follows your process over the course of the next 12 months. And then after that, you will renew your membership to continue to use the logo. So congratulations.
Fantastic. Thank you so much. How exciting. It's nice to know that I've passed and have the certificate, because it shows me that I have been doing the right things, and I want to champion that as well for all of my colleagues in the same space, that we continue to strive to make the best content we possibly can.
Yeah, definitely. And you earned it. And I know it's a process, you have to make sure you meet all 10 criteria and provide the evidence for those criteria. And we look forward to all of the health information that you will create in future to support patients and the public with their health, and also with organizations with their campaigns. And you'll also be listed on our PIF TICK individual creator directory with links to your social media channels and your website. And we update and send this list to GPs and healthcare professionals twice a year as a resource, so they know where to find trusted health information for their patients. And also the public will be able to see from you having the logo on your content that you are a trusted health information creator. So thank you so much for your time today, Dr. Asmine.
It's been an absolute pleasure, Virginia. Thank you for having me.
Thank you so much. So for the audience that's watching or listening, if you'd like to learn more about the individual PIF TICK and how to earn your own trusted information creator certificate, then go to our website, and I'll leave a link attached to this post. Thank you so much for watching. Bye.